Hello, my name is Mini and I am one of the Brandman DNP students. And this is Ivana, my daughter, and she has volunteered to be my patient for today. How are you today?
Good.
So, what brings you in today?
I need a comprehensive physical examination for my water polo.
Oh, that's good to know. So, do you have any health related problems?
No.
Okay. So, Ivana, you looked well groomed, well nourished, and well dressed. And for the purpose of today's test and video, we will be not doing the genitalia and breast examination, but I'll be explaining about it later. And your privacy will be maintained at all times. If you have any questions, please let me know. It might take close to 40 minutes and just be patient, but then you have any questions, please feel free to ask me, okay? And Ivana's vital signs have been checked. Your blood pressure, pulse rate, your oxygen saturation, height and weight and temperature are all within normal limits. And I'm going to wash my hands before we begin. Okay. Do you have any allergies?
No.
Okay. And do you take any medications?
Well, my mom gives me multivitamin tablets every single day.
Okay, that's good to know. Okay, and her parents have confirmed that she did not have any problems related to medical or surgical history, and she has completed all her vaccinations. Immunizations are up to date, and in her family there is nobody who smokes or take any illicit drugs or use any alcohol. And which grade are you in now?
I'm in 4th grade.
Okay. So, and do you live with?
My parents.
Okay. And so she has her grandparents and parents and great grandparents who were all diabetic, and your dad is diabetic now?
Yeah, he is.
Okay. And also some of them had hypertension problems too. Otherwise, there were no other major concerns in the family. Now, her parents have also confirmed that she has no OBGYN or psychiatry related problems. Okay, now I'm going to start to the physical examination. Okay, physical examination always starts with observation and going to the palpations and other tests. Okay, so I'm looking for your skin, for your hair, and for your nails. Okay, your skin looks, it has normal distribution and texture looks good. For your skin, looking for the skin distribution, any kind of ulcers or lesions or any trauma or injury signs, and for the skin turgor. So I'm going to pull her skin like this and leave it loose, and it goes back to the normal shape, and so it is normal. Okay, and for her nails, I'm going to check her shape, the contour, and for any clubbing, and also checking for the capillary refill. And I'm going to press here and leave it loose. You can see that the capillary refill took only 1 second, and which is normal. Moving on to the head and your face. For the head, I'm going to look for the any asymmetry, any lesions, any bumps, or any problems, and I don't see it. I'm going to palpate her scalp. When I'm palpating her scalp, I'm looking for any lumps, any bumps, any lesions, any discoloration anywhere. No, I don't see anything. Good. I'm looking for the face, also for the symmetry of the and shape of the face. Any scarring, any acne or pimples, and I don't see anything. I'm going to go to the palpation. I'm palpating your sinuses, okay? And let me know if you have any pain when I palpate. Checking the frontal sinus. Any pain?
Nope.
Your mastoid sinus, any pain here?
Nope.
Ethmoid sinus, any pain?
Nope.
Alright. The TMJ, can you open your mouth and close? I can feel the TMJ here. And looking for the eyes, for her eyebrow, her eyelashes and also her sclera. Inside the sclera looks white in color. Pupils looks good, and also the conjunctiva. The conjunctiva is pink in color, which is normal. Okay, and also I'm checking for your nose, nares, to check for any asymmetry there, any nasal deviation. I'm gonna use my torchlight here, and going to use the otoscope to check inside her nose for any tabernae and any discharge or any bleeding, and I don't see anything there, which is good. And I am also going to check your ears and her pinna, the external ear. Any pain when I'm touching here?
No.
Okay, so she has no pain, no discharge there. I'm going to also look inside your ear. Okay, that is for the eardrum. And for the eardrum, I have to check the otoscope. Okay, for the kids, I have to pull the pinna down to get a good view of the eardrum. But for adults, I have to pull the pinna upwards and backwards. So in her case, I'm going to pull it down, and I'm going to go inside to see for her eardrum. And her eardrum is nice, white, pearly in color, and I have to check both sides, and that is normal for you. Okay. Now moving on to her mouth, I'm looking for the lips to see if there is any signs of cyanosis or dehydration. Can you please open your mouth for me? Looking inside her buccal cavity, and also can you move your tongue up and down? Okay, and checking for her teeth to see if there is any problems there, and I do not see any issues there, which is good. And I'm going to palpate your mastoid process, which is behind her ears. Also checking for the lymph nodes. Here is the occipital lymph node behind her neck, and looking for the submandibular lymph nodes. Any pain there? And I'm looking for the tonsils to see if there is any problem with the tonsils, and also checking for the ulnar lymph nodes. And her neck, I'm checking for any asymmetry of the neck, any discoloration or any problems. Checking for the carotid pulse here, and the jugular vein here. I can see the jugular vein, and I don't feel the pulse here, but it is normal. And looking for the thyroid here. Can you swallow? Okay, I'm checking thyroid. I have no problems there too. Okay, that's good. And now we are moving to check her cranial nerves. So the very first cranial nerve is olfactory, and that is for helping with the sense of smell. Okay, and Ivana, you have to close your eyes and close one nostril, and you have to tell me what that smell is. Okay. Okay, can you close one nostril? Okay, smell this.
Masala.
Okay, that's masala, that is correct. And I'm going to check the other nose. Okay, there. Can you smell?
Coffee.
Coffee, okay. So she was able to tell me the difference, which means her olfactory nerve is working. Now we are moving on to checking your optic nerve, which is the second nerve, okay? And for that I have to use the ophthalmoscope. In order to use the ophthalmoscope effectively, you have to make sure that you ask the patient to look away from there, and you're going to point it towards, can you look away? And I'm going to point to the retina, and I'm looking for her optic disc. I was able to see the rods and cones, and also looking for any glaucoma or diabetic retinopathy, and in her case I didn't see anything. So I'll be doing the test in both eyes, okay? And now we have to do other test, which is to test her other cranial nerves, which is cranial number 3, 4, and 6. And in order to do that, I'm going to do some of the test here. Okay, Ivana? All right. So, checking for the direct and consensual light reaction, pupillary reaction. So, can you please look here? When I am doing it to the right eye, I can see the left pupil also moving towards the light, and that is called as a consensual pupillary reaction. So her direct and consensual pupillary reaction is good. Now, Ivana, can you look here and look away there? Look up there and look here too. I can see her pupillary moving towards the same, reacting in the same way symmetrically, and that is normal. Okay, and I'm also going to check to see if all the other nerves which helps with your eye movement is working. For that, we need to do the 6 cardinal signs. Okay, so for the 6 cardinal gaze signs, it's called as 6 cardinal gaze signs. So Ivana, look here. Okay, and without turning your head, keep looking on the tip of my fingers, okay? To the upper right, far right, lower right, to the midpoint, to the left, middle left, and lower left, okay? So you're able to see that, and so that is a good test, and she has no problems with her nerves. Okay, and now I'm moving to check to see her 8th cranial nerve, which is helping with her hearing, and for that I need to do 2 different tests, which is Weber and Rin test. For the Weber and Rin test, I'm going to use this tuning fork, and I'm going to tap here, Ivana, tap here, and the vibration here, you should be able to feel the vibration on both sides of the ears correctly without any problems. Okay, so here. Can you hear the vibration? Okay, that's good. And so the Weber test is good. She has no hearing problems. Now I'm also going to check for the Rin test. For the Rin test, I am going to tap here and going to put it in the mastoid process. Can you hear? Can you feel the vibration? Tell me when you stop it. Okay. Can you hear it now? Tell me when it is done. Okay, good. So for the ring test, it was good testing, and she has no hearing problems. It confirms that the air conduction is better than the bone conduction, and I'll be doing it on the other side also to make sure that she has no problems with her hearing. And next one is the cranial nerve number 11, which is the accessory nerve. Can you shrug your shoulder against my finger? Okay, that's good strength. And now can you move your cheek against my hand? Okay, she has good strength there, and that is good. Now I'm checking for the cranial nerve, which helps with sensation. Okay, so I have a cotton ball here. You have to close your eyes, Ivana, and I'm going to, you tell me where I am putting this cotton ball, okay? All right.
My forehead, my cheek, my nose.
Okay, so she was able to tell that, and that's good. And also I'm going to check for the other cranial nerves, which is cranial number 9, 10, and 12, which helps with her tongue movements, cough reflex, and also the gag reflex. So in order to do that, Ivana, can you please move your tongue? Okay, can you cough? Okay. Can you open your mouth completely? Say ah, say ah, ah. You have to say ah. Okay, I can hear the gag reflex, and that is good. And the trigeminal, the motor function to see if the TMJ is working well. Can you clench, bite your teeth? Say like that. Okay, so that's moving good. And also to see the movement of the nerve, to function of that nerve. Can you wiggle your eyebrows? Okay. Can you chew? Pop out your cheeks? Okay, so she was able to do that also, which means that all her cranial nerves are functioning well. Okay, now we have to move on to the chest and the lungs. Okay, in order to do that, I would like to ask you to turn to that side for me, please. Okay, are you doing okay? All right, thank you. So, first I'm looking for any asymmetry or any kind of scoliosis or any problems with her chest, and I don't see the posterior aspect of the chest looks okay. Ivana, I'm going to do the auscultation now, and whenever the diaphragm touches your back, you have to take a nice deep breath, okay? Nice deep breath. Again. 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 Okay. She has no raised bronchi or wheezing, and that is very good. Okay, now Ivana, when I'm touching here, just say 99 and I'm checking the tactile primitus. Okay, see?
99. 99. 99.
Okay, I can feel the vibration, and that is a good sign. And I'm going to also do the another test called as diaphragmatic exertion. For that, Ivana, you have to take a nice deep breath and hold. Can you exhale completely? Hold. Okay. Okay, that's fine. Now you can breathe normally. So the tympanic versus the dull sound of the diaphragmatic movement, I was able to see that, and that is almost like 3 to 5 centimeters. The normal for her, it is close to 4 centimeters. Now I'm also going to check the respiratory exertion. I'm going to put my hand over the 10th intercostal space and going to ask her to breathe. Take a nice deep breath for me. Okay. Okay. So when she's doing the exhale and inhaling, I'm able to see the movement of my thumbs in the 10th intercostal space, and that is normal. So I'm done with checking all the functions and all the tests at the back. Okay, can you turn? Also, one more thing I'm going to check is for severe tenderness. Ivana, let me know if you feel any pain. Severe tenderness is checked to see if there is pyelonephritis or any kidney problems. Okay, so let me know if you have any pain. Okay, any pain? Any pain? Any pain? Okay, she doesn't have any pain, which is a good thing. Okay, the same way I'm going to check your anterior aspect of your chest also. So looking for any abnormal findings, and I don't see anything. I'm going to auscultate again, Ivana. Okay. Take a nice deep breath for me. Okay, her lung sounds are very normal, and also I'm going to look for the tactile primitus. Can you say 99?
99. 99. 99.
Okay, so when I'm doing that, I can hear the vibrations, and that is normal. So I have completed those tests for the chest and the lungs. Now we are moving on to the cardiovascular system. For that, I'm going to start checking her pulses. For the pulse, I'm looking for the rate and the rhythm. The rate, anything between 60 and 120 is normal. So the first one is the radial pulse. Checking the pulse here. Then I check the brachial pulse here. And I have to check the pulse for her here, carotid pulse right there, and I'll be checking her jugular venous pressure when she's lying down, which I'll be doing it in a few seconds. First I'm going to auscultate. Okay, Ivana, so for the auscultation, Here in her second intercostal space on the right side is the aortic sound. Here is the pulmonic sound. Here will be the Erb's point, the tricuspid, the mitral, and then the proximal point of maximum impulse, which is on the mid clavicular line in the fifth intercostal space. Okay, so I'm going to auscultate Ivana. Okay, take a nice deep breath. Nice deep breath. You don't have to, just breathe normally. Erb's point, tricuspid, comes to straight, mitral. You're going to use the bell and do the same thing. Mitral, tricuspid, Erb's point, pulmonic, and aortic. In her case, I don't hear any split S1, S2 or any S4 or S3 sounds, and which is normal. Okay, Ivana? And I'm going to check the jugular venous pressure. For that, I would like you to lie down for me. So, what I am going to do is, like, I'm going to stand in the right side of the patient, and Ivana, can you please turn to that side? Okay, and I'm looking for the jugular oscillation here, the meniscus oscillation here, and I can see it. I'm going to put the thing there, and I'm going to go to the central portion of our intercostal space, and I'm going to measure the difference between the pencil and the scale, which is almost close to 1.5 centimeters in her case. And the jugular venous pressure testing is done to see if there is any kind of fluid overload or pulmonary edema, and this is a very helpful test. Can you sit there for me? Alright, so now we are moving on to checking your abdomen. Okay, for the abdomen, I have to check for any kind of discoloration, asymmetry, any lesions, or any umbilical hernia, or any problems there. I'm going to palpate and also auscultate. Okay, so can you please lie down one more time? Ivana, this could be a little bit ticklish, and just let me know if you have any problems. Okay, so I'm checking for the liver. Okay, palpating for the liver and for the stomach, for her pancreas. Any pain?
No.
Are you okay?
Yes.
Alright, I'm checking to see, this is where the kidneys are, and I'm going to check to see if there is any problem, with any appendix or anything like that. Any problems there?
No.
Okay. Now I have to palpate, sorry, auscultate for the normal vowel sounds in all four quarters. Also checking for the abdominal aorta, renal aorta, renal artery, iliac artery, and femoral artery. Everything is normal. I'm going to check the same way on the other side also for the renal, iliac, and the femoral artery pulsations. Okay, and I have to do some test here. The first one is the Murphy's test or Murphy's sign. This is to check for cholecystitis or any gallbladder or liver problems. For that, I have to ask Ivana to take a nice deep breath and palpate here, and if she experiences any pain, that time I know that she has some problems. Can you take a nice deep breath? Any pain? Alright, so she doesn't have any pain, and that is very good. Now we're going to do the obturator and Soya signs. These tests are done to see if she has any appendicitis. So for that, the very first one is the obturator test. For that, Ivana, I am going to have her bend her right knee, and I'm going to hold here and do an external rotation, external movement of the tibia, and you can see that the thigh is flexed, and if she has appendicitis, it's going to be very painful. Did you experience any pain?
No.
That's good. This for the Soya sign, I'm going to have her raise her leg, right leg. I'm going to apply some pressure here. Can you push against my arm? Pressure here, and you can see that if she has any pain over here, she will be screaming with pain, and in her case, she has no pain, and that is another test to find out appendicitis. Alright, can you have a seat here?
Yeah.
Okay. I needed to also do one more thing, to palpate your aorta.
Mm-hmm.
Okay. I can see it. I can feel the palpation. Okay. The pulsation. Okay, that's good. Now we are moving on to the neurological exam.
Yeah.
For the neurological examination, I'm going to ask you to do some things for me, okay? So can you touch your finger, with your finger, touch my finger and touch your nose. Okay. That's good. Can you do rapid alternating movements like this? Very good, very good. And then can you do shallow knee bend like this? Shallow
Like it
knee
up?
bend. Yes. Shallow knee bend. Okay, that's good. Can you lie down, please? I'm going to do the heel to shin test. For that, I'm going to ask her to bend her knee, like come and like that. And can you take your heel all the way down in a straight line? Do the same thing on the other leg. Okay, get up. Yeah. So she was able to do that test, and that is good. And her cerebellar, there is no damage there. And now we're going to do the Romberg's test of approximation. For that, can you please stand and very straight and close your eyes for me. She has no tendency to fall, and this means that it's not a positive Romberg's test, and her cerebellar function is intact. Now we are going to do a tandem walk. For the tandem walk, please do walk like from your heel to the toe. Just walk like that. Yeah, within a straight line.
Don't you close your eyes?
No, just look straight and keep coming without falling. So that's good. And go back the same way. Okay, heel to knee, and that's good. Can you do a couple of normal walks? Just normal walks.
Backwards.
Okay, that's good. Can you walk on your knee? Heel, sorry, on the heel. Okay, and on your toes, just on your toes. Okay, all right, have a seat. So I'm going to also do another test, that is to find out pain sensation, and this is for to find out if we can differentiate between the sharp and the dull pain.
Yeah.
Okay, for that I'm going to have you close your eyes and let me know if it's sharp or dull. Okay, I will be very careful. Don't worry about this. Okay. All right. Close your eyes for me. Tell me what.
Sharp. 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 Dull. 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 Dull.
Okay. So you passed that test. Were you nervous?
Kinda.
That is okay. I'm sorry about that. Okay. Now I'm going to check the reflexes. And before we move on to the reflexes, we are doing the vibration testing. So for that, I am going to tap here and I'm going to put this side on your body prominences of your fingers and your toes. Let me know if you feel the vibration. All right? Okay.
Yeah.
Do you feel it?
Yeah.
Feel it?
Yeah.
Okay. So the vibration test is good for. Okay. Now,
It's negative.
now we are going to check the reflexes. For that, I am going to do the first one is brachio radius. So for that, I'm going to tap here using my hammer, and you can see the movement here and also the movement here. All right, it's not going to hurt you. Okay.
No.
All right, you can see the movement there, and here I'm checking the biceps movement here and the triceps. Okay, the movement over here, you're able to note here and then the movement. And now I'm checking for the patella. For the patella, just leave it loose here, and I'm going to tap here. Okay, we can see the movement here and also movement there. This movement there, and also the Achilles bone. For that, I'm checking here. Okay, just leave it loose. Okay, you can see the movement here, and then now it's the plantar flexion or the Varghese sign. So I'm gonna do this, and when I do this, we can see her plantar flexion, and that is called as the Varghese sign, and that is good. If she was 2 years or younger, you could see extension instead of flexion. Okay, and that is normal for you. Okay, now I'm moving on to checking your musculoskeletal system, and that is the last system. So thank you for being patient. All right. Okay, now we are going to check all her joints. So have a seat. Have a seat there. Okay. I'm looking for the joints to see if there is any pain, redness, or any swelling. Do you have any pain or swelling pain here
No.
when I touch? Okay. Looking for the wrist joint, and you have any pain?
No.
Okay, that's good. Looking for the brachial joint here, for the lateral and median aspect of her joint. Any pain here?
No.
Okay. And I'm also looking for her shoulder to see if there is any swelling or any pain there when I'm palpating, touching. Any pain?
No.
Okay. I will be repeating all these tests on the other side as well. So can you lie down here? I need to check your hip joints. Turn to the other side, please. Okay. And here I'm checking to see if she has any hip joint problems here, between here and created trochanter and not here, and I don't see any problem here. Any pain?
No, that tickles.
Oh, that tickles. I'm sorry. Okay. Can you lie down straight? Okay. I'm checking her patellar joint, knee joint. Checking for lateral and aspect of the meniscus, lateral aspect and the posterior aspect. Any pain? Okay. All right. I'm checking here to see if there is any problem with her ankle joint, and I don't see any problems. No swelling. Any pain?
No.
Okay. Her toes and her feet joints here, and I don't see any problem. Okay, that's good. Have a seat here for me, please. I am also going to check her spine. So can you turn this way? So when I check her spine, I'm going to palpate from here to check all her spinal vertebrae joints to see if you have any pain. Any pain here?
No.
Okay. Now we are moving on to the to check the strength of her joints and the muscles. So Ivana, when I am pushing against you, please push back to see if you have good strength. Use all your strength. Okay. Can you do this? Push against. Okay. Up. Okay, you're strong. Okay, here. Okay. Can you lie down for me? Okay. Can you push against my... Oh, okay, you're strong. Okay, one more. Okay, that's good. And here. Okay, good. Come on. And now I'm going to check the range of motion to see if she has all the range of motion for the joints. So Ivana, please do like how I'm doing, okay? So flex, extend, abduct, adduct, flex, extend, adduct, abduct, flex, extend, supination, pronation, and for checking the shoulder, and this is flexion, extension all the way, and internal rotation and external rotation all the way. Okay, so you are able to do that. So please lie down. I'm going to check for her hip joint to see if it has all the good range of motion. So can you please lift your leg all the way, flexion, extension, adduction and abduction. For the knee, do the same way, flex, extend, adduct and abduct. And for her leg, for the feet, it's flexion, extension, inversion and aversion. So did you have any pain when I was doing that?
No.
Okay, that's great. Can you please sit there? Alright, now we are almost at the end of our exams and we have to do some testings to make sure that your knee has no tear or any kind of dislocation, and that your shoulder has no dislocation or tear or any injury, and also to check your arms, okay, to see if you have any problems there. Alright, so I would like you to lie down for me if you don't mind. The first one that we are going to do is McMurray's. Okay, for that I have to ask her to bend her knee 80 to 90 degrees, and I'm going to use this hand of mine to hold her knee joint, and I'm going to use the other hand to press against, and I'm going to do the outward rotation and inward rotation here, and checking to see if she is complaining of any pain or any kind of sounds that you can hear. And I don't hear any abnormal sounds, or she's not complaining of any pain, so the McMurray sign is negative and she has no problems. Okay, Ivana? Okay. Next one is Varghese and Varghese sign. It's a Varghese and Varghese test. This is also to check her knee to see if everything is fine. And for this, I am going to have to hold her like that, and I'm checking to see, I'm applying pressure on the Varghese side and to see if she has any pain there. And in order to check her Varghese side, I'm going to also take it like this and apply pressure on the Varghese side, which is the inner side aspect of her knee joint, and she will be able to tell me if she has any pain, any popping sound or any problems here. I'll be able to find out. So that is the Varghese and Varghese pain with this test. And the next one is anterior drawer test. For the anterior drawer test, what I'm going to do is that I'm going to ask her to bend her knee, and I'm going to apply some pressure here, force, so that the tibia will go into the fibula cap. And if the distance or the movement is more than 5 millimeters, there is some ligament problems or any rotation, cuff rotation, or any kind of knee joint problems. So tell me if you have any problem. I'm applying, it's like a drawer, closing the drawer. Is there any pain?
No.
I don't see any problems. So she has normal knee joints, and I'll be repeating the same thing on the other leg. Okay, now we are moving on to her to check her shoulder. So the very first one is the apply scratch test. For the apply scratch test, can you please get up? And you have to do internal rotation and external rotation. She should be able to touch her hands like this, and this is the apply scratch test, and that will be repeated on the other side also. And Ivana has no problems, and that's very good. Okay, now we are going to do the empty can test. Ivana, can you extend your arm and going to do the pronation, and as if you're pouring out of a cup. And while she's doing it, I'm going to apply some pressure here. Any pain?
No.
And I don't, if she had any frozen shoulder or any kind of rotation problems, she will have pain when I'm doing that. And next one is the drop arm test. For the drop arm test, please do like this and slowly drop your arm. Slowly. That's very good. If she was not able to do it slowly and if it drops, that means there is some problem in the shoulder. And now I'm going to do the apprehension test. Can you please lie down for me? For the apprehension test, I am going to have her bend her shoulder, keep her shoulder like this, and 90 degrees will be her hand like this, and I'm going to apply some pressure, slow pressure, and if she is showing some signs of apprehension or pain, that means that this test is positive. Let me know if you have any pain. Alright, she does not show any sign. Get up, Ivana. Come sit there. So she does not show any signs of apprehension, and that is the apprehension test. Okay, now the final one is for the carpal tunnel. Okay, so there are two tests to check if we have any carpal tunnel problems, and that is Tinel's test and Fallon's test. For the Tinel's test, I'm going to apply some pressure here, and if she had any carpal tunnel, she will experience some tinnitus or some kind of numbness. Let me know if you have any numbness or tinnitus. You feel anything?
No.
Okay, so that means that is negative, and if she had any problems, she would have had numbness or tinnitus. The last but not the least is the Fallon's test. So you're going to have your hand like this. Can you hold like that for me? Okay, so she's going to hold it like that for 30 to 1 minute, 30 seconds to 1 minute. And if she had carpal tunnel syndrome, then she will experience numbness or some kind of tingling sensation on her, the tip of her fingers and arm. Do you experience anything?
No.
No, you have no problems? Okay, so that means she doesn't have any carpal tunnel problems too. All right. So this actually completes the physical examination today. Are you okay?
Yeah.
I know that you were experiencing that you were going to be sleepy in between. I'm sorry it took a long time. All right, you did a good job. You have any questions for me?
No.
Okay, so you can go now, and thank you so much.
You're
Thank you
welcome.
for watching.